Lie on your back on a firm surface, such as a bed or a mat on the floor, with your knees bent and feet flat against the surface. With your elbows bent, position your hands just below your waist with your fingertips pointing towards your belly button. Tighten your core muscles so your back doesn't move as you raise one foot a little bit off the surface. Pause and lower with control. You should feel the muscles under your fingers harden as you raise your foot without movement in your back or pelvis. Repeat on the other side, alternating legs. Common errors include arching your back during this exercise or raising your foot too high, which can cause your pelvis to roll back. The key is to perform this motion with control and without moving your back or pelvis. Keep a slight arch in your back. Lift your foot only slightly off the surface and remember to breathe. With your feet hip-width apart, about 3 foot lengths away from a counter, rest your hands flat near the edge of the counter. Lean forward so that your shoulders are over your hands. Tighten your core muscles so that your lower back does not sag. Your hips and ankles should remain in a straight line throughout this exercise. Start with a 5-second hold and repeat 3 times, gradually increasing the time you hold to 10 seconds. Moving your feet further from the counter will make the exercise more difficult. Common errors include allowing your back to sag, bending too much at the hips so that your body angles away from the counter, or hiking your shoulders up towards your ears. Remember to keep your shoulders down and relaxed away from your ears, and your core muscles firm to support your back. It's more important to keep a perfect posture with your body in a straight line than to hold for longer or do more repetitions poorly. Start on your hands and knees with your hands just above shoulder level. If this is uncomfortable, place a large rolled up towel under your knees. Firm up your tummy so your lower back doesn't sag as you lean forward, so your shoulders are directly above your wrists. Start with a 5-second hold and repeat 3 times, gradually increasing the time you hold the position to 10 seconds. To make the exercise more difficult, raise your knees off the floor so that your shoulders, hips, and ankles are in a straight line. Common errors include allowing your back to sag, bending at the hips, hiking your shoulders up towards your ears, or straining your neck by looking up. You can avoid these issues by keeping your core muscles firm, your shoulders relaxed and pulled back away from your ears, and keep your gaze forward at the floor, keeping your neck and spine straight. Lie on your back on a bed or a floor mat. Bend one knee, keeping your left foot flat on the bed or floor and your right leg straight. Keeping your core muscles tight, push your right leg down into the bed or floor for a count of 3. You should feel your glute or buttock muscles tighten, slowly release. Repeat on the other side. Make sure to tighten your tummy to avoid arching your back as you push your leg into the bed or floor. Keep breathing and keep the motion slow and controlled. Lie on your back with both knees bent and your feet flat against the bed or floor, hip-width apart. Squeezing your buttocks, lift your pelvis towards the ceiling, keeping your arms straight along your sides and your shoulders and head on the ground. Try to raise your pelvis as near to the point that your knees, hips, and shoulders would form a straight line from the side view rather than sagging in the middle. You may have to limit how high you raise your buttocks according to your ability or if you experience any increase in low back pain. Pause at the top, then lower slowly. There's no need to hold this pose. Make sure to avoid letting your knees collapse inward as you perform the exercise. Keep your hips, knees, and ankles in line and keep your buttocks squeezed until you've fully lowered your pelvis. Otherwise, you're likely to experience an unpleasant hamstring cramp or a cramp in the back of your thighs. If you are weaker or have sore shoulders, elbows, or wrists, using a wall for support is a good alternative to the side bridge using a countertop. Position yourself 1 foot length away from a wall. Turn your feet so that they're parallel to the wall, placing your right arm against the wall. Let your hips shift sideways towards the wall. While tightening your core muscles, move your hips away from the wall until your ankles, hip, and shoulder form one line. Repeat on the other side. Be careful not to bend forward at the hips or waist or twist your back while performing this exercise. Keep your core muscles firm and move as if the front and back of your body are sandwiched between 2 plates of glass. For this exercise, position yourself 2 foot lengths from a countertop. Turn your feet so that they are parallel with the countertop and place your right hand on the counter. Let your hips shift sideways towards the counter, then move your hips away from the wall or counter until your ankles, hips, and shoulder form one line. Repeat on the other side. As with the side bridge with wall support, be careful not to bend forward at the hips or waist or twist your back. Keep your core muscles firm and your body aligned as if the front and back of your body are sandwiched between 2 glass plates. Hold each stretch for 30 to 45 seconds without bouncing. Go to the point where you feel the mild discomfort in the muscle, but can remain relaxed and still breathe calmly. Repeat each stretch 1 to 3 times on each side. Ideally, it would be beneficial to go through all the stretches to limber up the muscles you've just exercised. However, if you have limited amount of time, focus on the areas where you are likely to have limited movement. If you have knee osteoarthritis, you are more likely to have limited knee movement. Make sure to include knee extension, quadriceps, hamstring, and calf stretches to address these areas. If you have hip arthritis, you are likely to have limited hip mobility. You would likely benefit from hip flexor, adductor, side trunk, quadriceps, and hamstring stretches. As everybody's body is a bit different, make sure to include the stretches to address the muscles that are tight for you.